Welcome to the video. Techniques are not the basis of psychotherapeutic change. The lack of training and experience effects demonstrates that techniques have no inherent power. My name is Dr. Stephen Bacon. I'm in private practice in Santa Barbara, California, and I've spent the past decade writing books and investigating the topic of how psychotherapy works. Determining the effect of therapist experience. It's rather easy to determine whether experience is related to outcomes because we have many studies of psychotherapy effectiveness that include data on the years of experience of the therapists. Please examine this quote from a review article summarizing many studies on experience. The dozens of studies are summarized via meta-analyses. A meta-analysis is a statistical method of summarizing effect sizes across lots of individual studies. When done carefully, they are considered the best way to compare and understand disparate studies. As you can see from this quote, 4 separate meta-analyses found no evidence that experience is correlated with outcomes. Attempting to refute the no experience finding. As you can see from the quote, in 1995, Stein and Lambert found some mild evidence that experience is related to outcomes, and a later review from Hill and Knox found even milder effects. Significantly, when Lambert re-examined the area in 2004, he reversed course from his 1995 conclusions and decided that, after all, there is no evidence for an experience outcome effect. Recent large studies. 2 recent analyses of a very large number of therapists perhaps provide the most definitive evidence about therapist experience. Wampold and Brown found no effects for therapist experience level, years of practice, when they analyzed the outcomes of 6,146 clients seen by 581 therapists in a managed care setting. Similarly, Okishi et al. Found no effects of therapist experience on the speed of client improvement in their study of more than 5,000 clients seen by 71 therapists. It may be hard to believe, but these 2 summaries of the paraprofessional literature document a shocking result. Paraprofessionals do better, or at least as well as, licensed, experienced therapists. Paraprofessionals are individuals who work in treatment settings and provide therapy and counseling. Some have college degrees in non-therapeutic fields, others simply have life experience. None have formal training in psychotherapy. They are typically supervised by licensed therapists, and many of them have received modest training in weekend-type workshops. In terms of experience, paraprofessionals as a group have much less experience than psychotherapy professionals. There is mild evidence that therapists get worse with experience. The evidence shows individual therapists do not get better with time and experience. Worse, instead of improving, effectiveness plateaus early, then steadily declines. In the largest study of professional development to date, Goldberg and colleagues documented a diminution in performance, not unlike a slow leak from an inflated balloon. There are only a handful of studies that directly compare outcomes with therapists with no experience against experienced therapists. The most famous of these studies is from Stroop and Hadley, which showed that untrained college professors were capable of achieving equivalent positive outcomes in comparison to experienced licensed therapists. Significantly, that study was recently replicated when Anderson et al. Compared the outcomes of advanced clinical psychology graduate students with graduate students in non-helping fields like history or biology. They also found that both groups achieved equivalent positive results with normal neurotics. The training results are as dismal as the experience results. There are quite a few studies that support the concept that trainees can learn skills that should lead to better outcomes. For example, Hill and Knox, in their review of the training literature, cite studies showing that trainees can be trained to administer manualized treatments, that they can improve various skills such as listening, exploring therapeutic issues, and empathy, and that training reduces trainee anxiety. Unfortunately, these studies fail to demonstrate that these skills improved outcomes. Surely, supervision must improve outcomes. Nevertheless, after reviewing research spanning a century, Watkins writes, "We do not seem any more able to say now, as opposed to 30 years ago, that psychotherapy supervision contributes to patient outcome. Using a large 5-year naturalistic dataset consisting of over 6,000 clients seen by 175 therapists, Rosmanier et al. Confirmed and extended Watkins' conclusions. Once more, supervision was found not to be a significant contributor to clinical outcome." Attempting to cut through the denial of the field. Once again, beginners and the relatively untrained equaled the results of the trained and experienced. As you read the details of the study, I'm going to emphasize the way the authors attempt to cut through the denial of the field. The final quote goes, "It may be that researchers are loath to face the possibility that the extensive efforts involved in educating graduate students to become licensed professionals results in no observable differences in client outcome. We urge the field to squarely face the possibility that supervised novice counselors may be as effective as experienced counselors." The overall efficacy of training programs. These two summaries come from review articles about training programs. As you can see, both reviews found that training is not related to outcomes. The most important part of the Maloof study is contained in this sentence. Overall, research findings provide little support for the idea that typical professional training of psychologists leads to better outcomes for their psychotherapy clients. And the corresponding Hill and Knox quote is, "The results of these studies certainly do not provide direct evidence for the effectiveness of training. In fact, they call into question the very necessity of this training." Conclusion: training and experience do not enhance outcomes. Our goal was to settle the debate over the dodo bird thesis and to determine whether there are any specific factors in psychotherapy. The logic of our analysis was based on the fact that experienced and trained therapists know more techniques and have practiced them more assiduously than relatively inexperienced and untrained therapists. The clear lack of an experienced training effect on outcomes proves that techniques are actually rituals and that there are no specific factors in psychotherapy. This means that psychotherapy techniques lack inherent power. This means that the dodo bird theory is correct. This means that psychotherapy doesn't work like medicine. This means that psychotherapy needs a new direction if we're going to evolve. The next video looks at the immediate implications of these findings for psychotherapy. The following video explains why psychotherapy operates so differently than medicine. Later videos describe how to use this information to enhance outcomes and to empower a personal growth strategy.